Welcome all of you for this new video. So today's topic is about conformity assessments. So earlier we already have talked much about on clinical data, evaluations, plan, report, investigations, and so many things related with that. Now we talk about the conformity assessments. Now this conformity assessments is done by two sides. One is from the manufacturer side, where according to their protocols, their setups, everything's are on the same place or not, everything's are properly managed or properly formed or not. So manufacturer also do some conformity assessments after the medical device development. Once the medical device get developed, so what are the protocol, what are the standards, what are the procedures, what are the finishing things, everything's getting assessed by the manufacturers, one of the units, and they perform their own conformity. And that assessments of each and everything, whether it is clinical data, whether it's in vitro data, whether it's in vivo data, whatever the data they have, whatever the information they have related to the manufactured medical device, they assess each and everything, and they perform assessment of that, and that assessment is called the conformity assessment. And once the manufacturer feel that everything's are same and like everything's on correct way, the procedure and protocols, everything follows it very regulated and proper way, only then they decide to send all these documents and data to the regulatory and authorizing body before getting into the market for that medical devices. Now regulatory and authorizing body assess and evaluate every data whatever is submitted by the manufacturer in the form of technical documents, and after the analysis each and everything, like they can be sent by in the different format also, but in majority of the part is technical documents and some videography also. It may present some pictures, and everything is pictures maybe that going to be reported in the document itself. So after assessing each and everything and after evaluating each and every medical device related information which is submitted by the manufacturers, and then regulatory or authorizing body feel that everything's are correct and everything's are as per standards and as per rules and regulations, only then they authorize or they certified CE marking and other things which helps manufacturer to place their medical device into the market. Now one thing again, that is one the regulatory authorized body may approve, but each and every country have their own some specific requirement if we want to place our medical device into their market. So we need to fulfill their things, like we need to fulfill their requirements also, only then we going to be able to market that medical device in that particular countries. Now just giving you one information, like earlier England, or not England, is United Kingdom is a part of the European Union, but after the Brexit the United Kingdom is not a part of that. So again the European medical device regulations is a different, and in United Kingdom if your medical device have the European medical device regulations and each and everything, and you have the certification from there, but still if you want to market your medical device in UK, so you need to take approval from the UK MDR also, which is United Kingdom medical device regulation. They are more or less same but few differences. And in general UK MDR, the current UK MDR I'm talking about, this video is in 2023, I think 23 or maybe the 24. So till this time the UK MDR standards and the protocols and everything is more like earlier MDD, which is a medical device directive, European medical device directive, the earlier MDD. So they have the much more similarity with the MDD in compared to the MDR, only the few differences they have in compared to the MDD, but MDR having also few much more differences than MDD. So the point is that even if you have medical device regulations approval and everything, but if you want to sell these things in United Kingdom, then they have their own approval process. So we need to follow their approval process also. So like that, each and every country they have their own approval and regulatory approval process. On the same time, in the US there is a US FDA 510K approval process and everything. So their requirements are completely different. I'm just giving you an example. In the European medical device regulation, if something called post-market surveillance report, PMC, or maybe the post-market surveillance report, something, then in the US FDA 510K they have the something different. We have the PSUR, then they have the DSUR. So terminologies and names are also some different. So the name of the document is also different. But more and less each and everything are same, whether it is a UK MDR, whether it is a European MDR, or whether it is a US FDA 510K. Then more and less everything is same. So just we need to follow the whatever the standards we have, the ISO standards according to the type of the medical devices and their intended uses. So we need to follow that particular standards, and then we need to apply for this. So in essence, summarized form, if I say what is a conformity assessment, the conformity assessment is a process to evaluate each and every data which is related to the medical devices, which is submitted by the manufacturer to the regulatory authorizing body, and they assess their conformity, whether each and everything is in the proper shapes and proper, what I said, the proper as per rules and regulations. Then this is called the conformity assessment. And then after the assessment, if they happy, if they find that everything is in proper way, then they just certify that particular medical devices. So that is called the conformity assessments. Okay, and we already talked about the manufacturer side conformity assessment, whether they just want to see they manufacture that medical device, whether they manufacture the medical device in the proper protocol way and they follow the proper procedures and all. So they also need to assess everything, and which helps to submitting those documents and data to the regulatory and authorizing body. So this is for now for the conformity assessment. If you need detailed information in that, just DM me. I will go into that. I'm going to make a separate video on this. So that's it for now for the conformity assessment. We'll meet some another topic, some another video. So till then, bye, take care.